Hey guys, this is Brenda, lead nurse consultant of Zackel and Associates. Hallelujah, we made it to 2021. These next few Surgical Sunday videos are all about positioning. Today you will learn about the supine position, its physiological effects, best practices, and special considerations. The most common surgical position is supine. This position is used for procedures involving the head, neck, extremities, and cavities such as the chest, abdominal, or pelvic. The perioperative team should collaborate with the surgeon to determine if the supine position is most appropriate for the patient and procedure. Assess factors related to the procedure such as type and length, ability of the patient to tolerate the position, amount of surgical site exposure required, ability of the anesthesia professional to access the patient, positioning devices required, and potential changes in position. Because positioning can cause pressure injuries, it is also important to establish if the hospital uses a standardized tool to assess the patient's risk for developing these injuries. The supine position places extra pressure on the occiput, scapula, olecranon processes, sacrum, coccyx, and calcaneum. The OR team should implement measures to redistribute pressure to help prevent pressure injuries. Applying prophylactic dressings to high-risk pressure points reduces the effects of pressure, friction, and shear on these areas. Evidence of prophylactic dressings used could be found in the positioning section of the intra-op record. If no such documentation is clear, check to see if the patient was charged for these dressings in the supply record. The OR nurse is responsible for documenting what supplies were open and which ones were used. Best practices for supine positioning include positioning the patient's knees with about 5 to 10 degrees of flexion to prevent popliteal vein compression, or PVC, which can be accomplished with a soft pillow. PVC is seen when the knees are extended or locked. Position the patient's legs parallel to each other with the ankles uncrossed and with the heels elevated off the OR bed to increase perfusion and help prevent heel pressure injuries. The heels should be elevated in a way that allows the weight of the patient's legs to be distributed along the calf without putting excess pressure on the Achilles tendon or hyperextending the knee. Older adults may be susceptible to shear and pressure injuries, tears, and bruising. To avoid these injuries during supine to supine transfer, a minimum of 4 people is required for safe transport for a dependent patient who is sedated or unable to move. This is a particular concern with obese patients, but it is a safety risk when transporting any patient to the OR bed because skin injuries can develop when slid along rather than being properly lifted onto a surface. Has your client suffered from an injury due to negligent positioning in a hospital or nursing home? If so, seek the help of an experienced certified legal nurse to help uncover the crucial facts of your case. This is Brenda Zackel, bridging the connection between medicine and law.